Sorry.
No, yeah.
No, I'm not offended. I'm not offended.
Nobody wants to sit
I know. It's like on Forrest Gump, seats taken.
You can sit here. Is that your personal experience?
Although I do really love that. I do.
Okay. Thank you so much. It's good to be here today around an important issue, something that I talked about on the campaign trail. And this is just continuation of, promise made, promise kept. And oftentimes I'm asked what are the one or two issues you are going to focus on. And it's more than that. Having one or two issues and just a place where these communities have been ignored. Some of the basic and foundational issues that are needed. I'm not going to be a one-issue mayor. We're going to start the process of moving our city upstream to deal with some of the real problems that families are facing. And nothing is a more upstream approach than maternal health, from pregnancy through profession. And as I walk through this building, learning, not only do we have Department of Health and Mental Hygiene, who's here. Dr. Fassan met some of his team that is here on the ground. And many of these women, predominantly that are in this building, they were here throughout COVID. They were here even when they could have just sort of protected just their families. They were dedicated to the work. And I really want to thank them. And we're going to host them at Gracie Mansion to sit down and find out exactly what we should be doing on the ground because they have the best answers so that we can get it right. But we're here primarily today to talk about the Brownsville Neighborhood Action Center and what they're doing around ending maternal health issues, the disparities in maternal deaths and what is happening to everyday families, particularly Black and brown families. The numbers are horrendous, and it is unbelievable. It's not on the radar. People are just taking it as it's just a course of doing business. I saw that during the campaigning, and I stated that we were going to come back and address this issue. And, one person I'm just happy that's here with us is the borough president. Some of the things that you are doing, we are part of the Men Who Gets It Club. We understand that, and we understand the importance of what this work means. Black women die 9 times, more likely to die, 9 times more likely to die of pregnancy-related causes than white women. 9 times more likely. And you don't hear this. It's like no one cares. Well, we care. That's why we're here, because we care. And I said it before, and I will continue to say we can't ignore it, and we're not going to pretend as though the problem is going to go away. We're going to get on the ground and address this issue. And today, I am announcing with my amazing Deputy Mayor, William Isom, we're announcing a multifaceted initiative to help reduce these inequities. It is something that Dr. Fassan, the Commissioner of the Department of Health and Mental Hygiene, understands that it is important, and we realize that it's important, and we're going to focus on these issues in a real way. First, we're going to expand our doula program citywide. We're going to expand it citywide. I don't know who believes that when a mother gives birth that someone is standing there with a manual and telling them from pregnancy to the time of delivery that there's some instructions. There are not. You need to support, and doulas are aware of how to do that. The doula program in New York City started in 2010. It was a great idea right here in Brooklyn, a model for public health and doula programs across the entire country. It started here on the borough of Brooklyn, and it expanded throughout the entire country, but we must go further. And now we are going to give both mother and child the care they need right from the start. Those first few months, everyone talks about K through 12, or they talk about from birth through professions. No, it starts in the mother's womb. The first classroom is in the mother's womb. The first nurturing, the first care, the mother's nutrition, what the mother eats. That baby's not getting McDonald's in the mother's womb. That baby is receiving his or her nutrition from what the mothers eat. And that mother is not receiving that information. She's not being able to provide the important nutritional balance that that baby needs, and stress. And what stress does to a mother, science is showing, is passed on to a child. So this expansion will provide free access for doulas, for birthing families, and focus on 33 neighborhoods with the greatest social needs. And we're going to continue to expand so that it will become citywide. And we're expanding the workforce. We're training 50 community members as doulas with the aim to reach 500 families in just the next 3 months. This is an aggressive goal of sending a clear message that we want to save children and families. The care our babies get before and after birth are so important, and we want to focus on that to stop the crises that we're facing. But we're going further. We're going to also launch a Midwifery Initiative. For the first time, the health department would gather and report on data on births and care with midwives across the entire city. We're going to connect the dots. They will create partnership with midwife organizations, hospitals, private practices, community members to better integrate midwives into our healthcare system, something that has been ignored. And we are going to dismantle those barriers that are not allowing the practice of midwifery to be part of how we have our overall health. We're going to expand our mental hospital, our maternal hospital quality improvement network to all 38 of our birthing hospitals citywide. This is going to be a citywide initiative. We're going to focus on the root causes of racial disparities in maternal health. We will offer trainings on implicit bias, trauma-informed care, and help hospitals support doula policies and practices is crucial. We want to acknowledge it or not, the reality is Black women are treated different when they go for health care. They're treated different. They believe that they have a higher tolerance of pain. It doesn't matter their social economic status. The level of treatment has been a hidden secret for far too long, and we need to be upfront about this, how we treat Black and brown women when they go for overall health care. And studies after studies have exposed this. We have to be honest about it if we want to fix it. So it's so important that we connect expectant moms and their families to vital resources such as healthy foods, prenatal classes, and doulas. We need to focus on those important issues. Every parent knows giving birth can be beautiful, but far too many cases it has been tragic. And the tragedy is physically, mentally, medically, and psychologically impactful for those families and what they go through. So today, we begin to address those disparities in maternal deaths, life-threatening complications from childbirth and infant mortality. We're going to protect parents. This is a real issue, and it should not be something that we ignore. And I'm happy to be here with this amazing team as we focus on this issue that has been ignored for so many years. This is something this administration promised on the campaign trail, and we're starting to deliver as we transition into the role and continue to transition into the role of the mayor of the city of New York and this administration. We're focused on this. This is a real issue for us, and we're proud to be here today. And I want to thank Deputy Mayor William Isom, who I will turn the microphone over to, for her commitment and dedication to this conversation. Deputy Mayor.
Thank you, Mayor. It's cold out here. Oh, my goodness. You know, I am so happy. I'm Ann Williams-Isom. I am the Deputy Mayor for Health and Human Services. But as we're having this conversation, I'm remembering giving birth to my firstborn 28 years ago and how difficult it was and how 36 hours of labor and 2.5 hours of pushing and people kind of acting like I should have known what I was doing, how much a doula would have helped. That difficult situation also then affected how I bonded with my daughter. No one told me. They were like, yeah, just, you know, you can nurse her. I didn't know how to nurse. I didn't know what I needed to do, and no one helped me. And I kind of felt like it was my own fault for a long time. And the thing that helped me was my mom, who happened to be a midwife in Trinidad and Tobago, right? But everybody doesn't have that. And so this is such an important day because how many women, right, are here that can tell stories of having very difficult births, not having support when they were nursing. Then it affects your bonding with your child. Everybody was like, are you happy? And I was like, no, I just really feel overwhelmed. Nobody wants to see an unhappy mom, right, with a newborn. So no one wanted to let me talk. I'm so happy. And this is such an important day so that women, and especially women of color, do not have to suffer in silence. Today is a day when we're expanding it, and I love the fact that we're going to be doing doulas and midwife. Right now, to tell you more about this program, I would like to bring to the podium the wonderful Dr. Michelle Morris, who really is the pioneer and the person and the passionate one behind this program. Dr. Morris?
Thank you so much, Deputy Mayor and Mayor, for the really incredible and inspiring remarks. I have to start off also by saying that my sister recently gave birth, and she didn't know what a doula was before we had a conversation. And so there's so many more birthing people who are going to be able to benefit from these incredible programs. We're really, really excited to get to announce them today. So I should say I'm Dr. Michelle Morris. I'm the Chief Medical Officer for the Health Department, and I'm also the Deputy Commissioner for the Center for Health Equity and Community Wellness. On behalf of the Health Department, it really is an honor and a pleasure to have you at the Brownsville Action Center. And as the mayor said, the time for birth equity is now. Too many families in our city experience life-threatening complications from childbirth and even loss of life of the birthing person and their child. We must hold ourselves accountable and health delivery organizations with us to our anti-racism mission and make health equity a reality for all New Yorkers. For too long, barriers stood between doulas and the families who would benefit most from their support. Accompaniment is about supporting, standing, walking alongside birthing people through all aspects of their birthing experience. And that's perhaps the most beautiful and personal gift we can share with birthing people as they navigate the groundbreaking, life-changing experience of creating life. And that is what doulas do. The urgency of this moment is clear. Mortality rates of birthing people are too high, and babies born to Black and Puerto Rican mothers in this city are 3 times more likely to die than in their first year of life than babies born to non-Hispanic white birthing people. But at this site here in Brownsville and our others in East Harlem and Tremont in the Bronx, families have a safe, welcoming, and supportive space to be connected to resources. These include childbirth education, newborn care classes, parenting classes, breastfeeding support groups, as well as free resources like cribs, car seat distribution, and diapers. And even as the health department provides these services and resources, we know we cannot make change on our own. We're a part of a community that includes families, hospitals, clinics, community-based organizations, insurers, providers, including midwives, doulas, doctors, nurses, and many others. So the Citywide Doula Initiative, the Midwifery Initiative, these build on and enhance the long-standing work of the health department, including programs such as the By My Side Birth Support Program, the Maternal Hospital Quality Improvement Network, as mentioned by the mayor, the New Family Home Visiting Program, Nurse Family Partnership, the Newborn Home Visiting Program, and community-based doula organizations. Expanding access to doulas and the quality care that they provide can save lives and will make a difference for hundreds of families in New York City. So we're so honored to be able to make this announcement with the new administration, with Mayor Adams, Deputy Mayor Williams-Isom, and Commissioner Vossen today, and the whole entire Brownsville and Brooklyn community. Thank you very much, and back to the Deputy Mayor.
Don't go too far. I know we have that little one who's going to be here later, but he's like starting to cry, right? I know that Borough President Reynosa is here. Would you like to say a couple of words?
Thank you so much. All right, welcome to Brooklyn. To everyone, I love when the mayor comes back home. We'd love for you to stay. But I just want to say one thing. Without coordination, the mayor's office invited the midwife that caught my baby in Woodhull Hospital here, Miss Grant, and I just want to thank her for everything that she's done. And I remember being at a Black men's event, talking about this in that event, and seeing the support of all these Black men in wanting to protect their Black women, and it was extremely powerful. It was actually a group of men that were coordinated by the borough president then, Eric Adams, and then I caught the mayor, because then he was the mayor. I caught the mayor outside and said, we got to do something about this, and it ended right there. It was like, it's done. We know what we got to do. No discussion. And he just said, we're going to get it done. So I just want to say, for me, this is very deeply personal, because I didn't know my wife had a likelier chance to die than any other woman when she was having a baby. And when that happened, I felt helpless, because there are things that I couldn't control to make sure that she had our baby and that she was alive. And that helplessness is something that I felt as somebody that I thought had influence and power. For folks that don't know, it can be crippling, extremely crippling. So I'd set out since that time, through the education of Ms. Grant, to be the foremost, the most aggressive advocate for midwifery and doulas that I would know. That's what I set out to do. And I'm being matched by Mayor Adams. And I'm so proud, because it's a lonely fight out here. Everyone knows these statistics. It's 9.4 times more likely for Black women to die than their white counterparts. Brooklyn is the most dangerous place in New York City for women to have babies. We're gonna, in 4 years, I want Brooklyn to be the safest place for women to have babies in New York. And if we get the opportunity to stay on for 8 years, to make Brooklyn the safest place in the country for Black women to have babies. That's the type of work we're set out to do. So I wanna end there, and I just wanna thank everyone that's behind us, all these women that are doing this hard work. We've, at a young age, we're taught as Black men to look out for our Black women, and I'm happy that we're finally here stepping up for you guys. Thank you so much.
So we heard about this great advocate, and they want me to call her a hero. I'm going to call her a shiro. How about that? Miss Helena Grant.
Thank you, everyone. Greetings to the mayor, the deputy mayor, the borough president, Dr. Norris, family and friends. We're all family and friends here. So on behalf of the Association of New York State Midwives and the New York City Health and Hospitals Midwifery Council, which I am chair of, I proudly stand with Mayor Adams' movement forward. We all know, we've heard the news, he likes to get stuff done, and that's what we're doing here right now. Today, we're getting stuff done on the front of maternal mortality, morbidity, and client satisfaction, because those things go together. It's not just okay for you to make it through and not have joy, not have your birth be a sacred experience for you. New York City can do better, and we will now, because we have a mayor that's finally paying attention to evidence-based research. This is not something that people don't know. New York City, the United States, is the only industrialized country where midwives are not in the forefront of healthcare for birthing families. And the research demonstrates conclusively that midwifery care addresses a lot of the issues that we're talking about here today: reproductive justice, birth equity, health disparities, maternal and infant mortality, morbidity, and primary care at a time when there are less providers. And since 2000, the state, and this country, we've been hearing a lot about this, about women dying overall, but of course, especially Black women. And I'm thrilled that we're finally pivoting towards talking about solutions that keep women alive. Midwives are leaders in the care of birthing families all over the world, and I'm glad that Brooklyn is going to be the first to collaborate citywide to make this initiative move forward. Me personally, I was asked to talk a little bit about my pathway and my calling to this profession. I've been a midwife 25 years strong in the borough of Brooklyn. I started my career at Downstate Medical Center in 1997. I worked there for 9.5 years with a cadre of about 7 midwives. We had a staff practice and a private practice. Our primary C-section birth rate was about 6 to 9%. We know that in the United States and in New York, it runs about 30. Then things change. The chair of the department changed. We have to speak the truth about what happens. What happens in hospital systems that change the outcome? Is it about what the women want, or is it about someone who takes on a power position and then things shift all of a sudden? Then things change, and this is a common story in a lot of the midwifery practices that were once thriving and loving on the communities they served. After a lot of turmoil, a lot of consciousness, a lot of meditation, I took a job at Woodhall, where I've been for 16 years and where I'm now director. At Woodhall, we have a cadre of 15 midwives. We care for midwives, for patients that are not just low risk, but a variance of risk. Our C-birth rate for primary is about 13%. Our vaginal birth after cesarean rate is about 67%. Where you have around New York City and the country, people telling women they cannot have births after they have a cesarean birth, which of course is increasing their maternal mortality and morbidity, because once you put a woman on an operating table, you increase her risk of bleeding, you increase her risk of infection. And these are the statistics that really should be transparently told so that women can make decisions about where they give birth. So with this collaboration, we are practicing team obstetrics. We welcome doulas in. We work with a great cadre of physicians and nurses, and team obstetrics matters because things are going to happen, and you want the proper people there to take care of clients when that happens. So in closing, midwifery does have the power to reconcile the abysmal statistics in New York City as it has in other industrialized nations. Google is your friend. Check what I'm telling you. And Mayor Adams, who has been a long time, this is not his first connection with midwives. Okay, he, along with then Councilman Reynoso, presented me with an award for health equity right at Borough Hall. He was on Mayors for Midwives when he was, doing his campaign. So this is not, a show for everybody here today. And I really want to enforce that. He's really serious, as is our borough president, to really change the trajectory of what happens in Brooklyn so birth can be safe, satisfying, and sacred in this borough and in New York City. Thank you.
Safe and sacred. And y'all, he's not joking. When he says GSD, y'all know that we're all trying to get stuff done. Thank you so much, Helena. That was beautiful. Before I call up the next person, I want to give a couple of shout outs. Brooklyn Perinatal Network, who I know you've worked with the mayor for years on this issue. Ewell Napier. Did I pronounce your name totally wrong? There you are. Give a shout out. And also Dr. Zahara McNutt. Thank you for all of your work. Okay, our next Shiro that I'm bringing up is Doula Tanisha Olivieri. Oh, right here. Perfect.
Hello, everyone. My name is Tanisha Adwa Olivieri, and as a woman of color and a doula and community worker, it is deeply, deeply gratifying to know that the mayor has this initiative. The citywide expansion of doula and midwifery service is extremely important. As you know, as it's been said before, Black women die at an increasingly alarming rate as opposed to white women as a result of pregnancy-related births. As a doula with By My Side support program, our team is limited in the amount of women that we can support. We have about maybe 5 zip codes that we support, and there's so many women in Brooklyn, in Manhattan, in Queens, Staten Island, Bronx that we need to get to so that we can help them. And with this expansion, we can support more birthing people of color who are disproportionately affected by systematic health inequities. I cannot stress enough, doulas and midwives are important. We make a difference between life and death of people and birthing people. It's already been mentioned again, as I said, but I want to say it again, and I want to say it again, and I want to say it again. Communities of color are disproportionately affected by health inequities, and we got to stop. It has to stop. Black women, brown women, we need help, and we can't move forward unless we are taken care of. And I want to say that I work with fellow colleagues, and we do this every day, and changing lives is important to us. We want to make it worth it. And again, I'm so happy that we are here and that we are making this initiative move forward. I have my client here, Anissa, who I've helped deliver her beautiful baby, Eden. And I want to just bring her forth so that she can say a couple of words about doula services in Brooklyn and New York City. Thank you.
Hi, everyone. My name is Anissa. I'm a proud mother of my 6-month-old son. Named Eden, and I also have 2 5-year-old twin girls. So as you can see, life is pretty busy for me. But I will say one thing: when I didn't have the resources that I had with Eden when I was pregnant, when I had my twin girls, and having Tanisha, she was my superhero. She made everything easy. It was smooth for me, and I felt safe with her. And having a doula is extremely important for, I think, every Black woman. I felt safe, and I think that is amazing to have this program. And having that emotional support, the physical support, and the mental support, most importantly, was amazing. And I just want to say, Mayor, thank you so much for all that he is doing for us. And as my family has grew, and it grew with little baby Eden as number 3, I also grew with an extra family member, which is my doula. I love her. She is my family, and she is our superhero. She is my son's godmother, and I am so happy to have her. So once again, thank you, Mayor, for all that you are doing, and just thank you so much.
Thank you. I want to talk about funding because there's been a concerted effort in the past couple of years to increase funding, at Medicaid rates. And there's been issues because, one, there's not enough people to be trained as doulas, so you have a dearth of people to move into that position. But then second of all, the rates have not been competitive, especially at the Medicaid level. And so I want to know, one, how much funding are you committing to this effort? And then also, how is this being paid out? How are you making sure that doulas are going to be able to be trained and at a rate that is then competitive to make sure that they're able to,
You have the exact funding number? You know the funding exact number? Mm-hmm.
Yes, we think it's incredibly important to expand this program so that more women get access, and it's one of the most powerful ways to influence policy is to show that we can get it done. So this is a multi-million-dollar commitment. We can get the exact number to you, but it's a multi-million-dollar commitment to expand doulas across the whole entire city.
But we'll get that exact number for you. Miss Allen, how are you?
Just talk to us. I know you took a tour inside. Just walk us through what you saw, what the mothers shared with you, your experience. Give us a glimpse of what that was like going inside. Just share with us what happened.
A clean, safe space, and the loving, nurturing atmosphere. As soon as you walk in on the second floor, look at the conference room where they're able to sit down and talk. Where you can get the items that you need. I know as the borough president, we gave out free strollers and playpens so babies didn't have to sleep with their mothers because of babies dying in that way. But in this space here, they're giving free items. They're talking about nutrition. I just think that we take it for granted that expectant mothers know all the things that they need to do. And that's the second floor we were on was a welcoming space that they matter. And I think that is often lost in government. So these women are doing an amazing job. They like what they're doing. And actually, the mother she's here? and the expectant mother was teaching one of the courses. You know, she has one of my voters on her way. You know, but you know, but come on, sit up here. You know, so I can get a nice photo. You know. But it was. I think that's a great question. We don't focus on the emotional aspect of giving birth, particularly in communities like these, where parents are not given the same level of nurturing. That's what I saw. I saw a nurturing, safe space.
Yeah, the 33 neighborhoods that you mentioned is where you're starting. Is there criteria for that you have? How about you distribute around the state?
Yeah, doctor, you want to? Mm-hmm.
Yeah, thank you for asking the question about the criteria for the 33 neighborhoods. The Task Force on Racial Inclusion and Equity defined these as the neighborhoods, the 33 neighborhoods across the city that had high social vulnerability and unfortunately also had a disproportionate impact from COVID, amongst other things. And so these are communities we know we have to reinvest in because they've experienced disinvestment over generations.
Doctor, can you share the exact formula and the weights for that metric you just described? Doesn't have to be at this moment, but can your staff afterwards?
Thank you for the detail. Yes, we can follow up with details on that.
Can you get the specific formula?
We can follow up, absolutely.
Yeah. We'll make sure you get it. Okay? All right. Listen, thank you, folks, so much. Okay, appreciate you. Okay.
Mr. Mayor, wanted to talk to you about there's 2,500 empty apartments that are supposed to be available for individuals seeking supportive housing. The Post has reported on it the past 2 days. Wondering, what will the city do to fix that 2,500 empty apartments, and that is equivalent to the 2,400 homeless individuals that you are trying to connect with services on the subway? So when did you hear about that, and then also what's your plan to fix it, and also how is that supposed to give New Yorkers confidence about the administration's plan to get homeless New Yorkers off the subways and connecting to services if these apartments have been empty and they're city funded?
Well, okay, first, New Yorkers should have confidence because I'm the mayor. And I'm going to get stuff done. We learned about the dysfunctionality of filling apartments when I was running for office. Jessica Katz and the other team, I stated, let's zero in on what's the problem. There are layers and layers of bureaucracy. For example, someone already has a mental health profile on record. We re-traumatize them and go through the whole documentation again. We're going to look to dismantle that. We have personal information on the person's ability to why they need the housing. We make them go from agency to agency and re-traumatize them. And so what you're going to see with Jessica Katz and our team, we're going to dismantle all the things within our span of control, but there's some other things that are in the span of control on the state level, and we're looking to dismantle that. We want to place people in the housing. It's a real problem. That problem existed prior to being here, but it's going to be fixed under my administration.
Will that be done with more staff through the HRA or more funding? Because right now it takes a little over a year to connect individuals with those apartments.
And it's unimaginable. No, we don't need more staff. People need to just do their darn job. This is not more staff. We have the staff to do it, but we have layers and layers of bureaucracy that must be dismantled. And I talk about this all the time. This is a dysfunctional city. I don't know when people are going to hear me say this. We have to stop the dysfunctionality. How do you have a vacant apartment when you need people to be in the apartment and you have so much paperwork that they can't get in the apartment? That is not how I'm going to run this city.
Hi, Mr. Mayor. How are you?
Good. How you doing?
Good. Looked at the.
You're making me cold without your socks.
Looking at the hearing this morning with your corrections commissioner, and he mentioned a new alternative to solitary confinement that we haven't heard too much about. RMAC, I believe. I want to see if you can expand on what this new policy is going to be for some of these more violent inmates at Rikers.
Listen, look, I love Louis Molina. I think he's a class act. He's one of my most important appointments. I think he's just committed. He's dedicated. And I cannot say this enough. I'm not going to allow those who are in jail because they were violent to go in jail and commit violence on staffs and inmates. 80% of people who were in what they call solitary confinement committed offenses against other inmates. Other inmates go to Rikers, they want to serve their time, they want to go home, they're being violated and abused. I'm not going to allow that to happen. And so we're moving away from the inhumane treatment of solitary confinement. We're going to punitive segregation to make sure people can get out of their cells, treated with the mental health services they need. Commissioner Molina is going to put that together, and I trust him. He testified today. He's going to roll it out. I have utmost confidence in Commissioner Molina. It's one of the most important commissioners that I had to bring on board, and he will roll that out. You want him to sit down and do a one-on-one interview with you? I'll make him available and make it happen.
Mr. Mayor, two parts. First, is Kyrie Irving allowed to practice in Brooklyn under the private sector mandate? And two, how do you know that the private sector mandate is actually being enforced?
Well, as we stated, the name of the game is that we were not going to be heavy-handed with the private sector mandate. We want people to get back into office spaces. And we're asking those who are the head of their companies to make sure that they create a safe environment for their employees. That's the goal. So we're not going to run around the buildings and check vaccines cards. We have communicated through the partnership with Kathy Weil. I've communicated with a number of business leaders. I brought business leaders to Gracie Mansion and sat down and spoke with them. So the goal is we don't want to close down our city again. And it's going to have cooperation to be put in place. If Kyrie Irving is practicing, I'm not at the sports facility. The attorneys can tell us if he could practice or not, if it's a violation of that or not. And I'll speak with my attorney to find out if it is or isn't.
Will they get back to me?
I'm sorry? Yes.
They will today?
Yeah.
Okay.
We'll make sure.